Hello everyone, this is Curious and hope you all doing well. In today's video, I'll be talking about diabetes home test explained. So if you like the video related to my health, my way, I would like to request you all please do subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin, let's go. Who is for testing tips, home versus medical, know your numbers. Now I'll be talking about the first part, what are diabetes home tests. Testing blood glucose sugar is an essential part of your diabetes care plan. Depending on your current condition, you may need to visit your doctor several times a year for formal testing. You may also need to go to your doctor for preventing testing such as cholesterol check and eye exam. While staying in touch with your doctor is important for staying on top of your treatment plan. You can and should test your blood sugar on your own as long as your healthcare team advises you to. Self-monitoring your blood glucose may be vital to your treatment. Testing your own level allows you to learn how to manage your blood sugar no matter the time of day or where you are. Now learn how these tests work and talk to your doctor about the benefit of self-monitoring. Now, who should use diabetes home tests? Your doctor will help you decide if you need to test your blood sugar at home. If you do, they all work out how often you should test and at what times of day. They will also tell you what your blood sugar targets are. You may consider diabetes home test if you have type 1 diabetes, type 2 diabetes, pre-diabetes, symptoms of diabetes. So by keeping track of blood glucose, you can discover problems in your current diabetes care. According to the Centers for Disease Control and Prevention, normal blood glucose ranges between 70 and 140 milligrams per deciliter. Low blood sugar is below 70 mg per deciliter, and high blood sugar hyperglycemia is well above 140 mg per deciliter. By maintaining glucose at a normal range, you may help prevent diabetes complications such as diabetes coma, eye disease, gum disease, kidney disease, nerve damage. Now, performing the test. Blood glucose tests come in varying form, but they all have the same purpose: to tell you what your blood sugar level is at that point in time. Most home tests need a lancet, small needle, and a lancing or lancet device to hold the needle. Test strips, a glucose meter, portable cases, cord to download data if needed. Home testing follow these general steps. Wash your hand, put a lancet into the lancet device so that it's ready to go. Place a new test strip into the meter. Prick your finger with the lancet in the protective lancing device. Carefully place the subsequent drop of blood onto the test strip and wait for the result. Results should generally show up within seconds. With some meters, you need to be sure the code on the strip matches the code on the meter. Also, be sure to check the date on the strip every once in a while to make sure they are not out of date. Finally, most meters now have a way to use an alternative site for testing, such as your forearm. Talk to your doctor to decide what is best for you. Now I'll be talking about the tips for accurate testing. The fingers traditionally offer the most accurate results. Some tests allow you to prick your thigh or arm, but you need to check with your doctor before doing so. According to the Mayo Clinic, your doctor will likely recommend a few tests per day if you take insulin. The exact number depends on the amount and type of insulin. Ask your doctor if and how often you should test yourself if you don't take the insulin. You may consider testing before and after meal to see how your diet affects blood glucose. It's especially important to test after eating simple carbohydrate or sugary food to make sure your glucose is not too high. It's also important to test whenever you make a change to your treatment plan or if you feel you are getting sick. A blood glucose chart is essential for tracking your result. Whether you keep track of your reading on paper or electronically, having these information can help you identify patterns and potential problems. You should save your chart and take them to your next visit with the doctor. When writing down your result, also be sure to log the date and the time of the test, any medication you are taking, as well as the dosage, whether the test was before or after a meal, food you ate. If after a meal, note the carbohydrate content of that meal, any workout you did that day, and when you did them. Home testing versus medical testing. Self-monitoring or blood sugar is crucial for determining how your diabetes is doing on a daily basis. It's unreasonable to assume that a few tests a year at the doctor's office can give an accurate portrayal of your condition because glucose levels fluctuate throughout the day. However, this does not mean that home tests should replace your regular preventive testing either. In addition to self-monitoring at home, your doctor will likely recommend an A1C test that measure how your blood glucose has been averaging over the last 2 to 3 months. According to the American Association for Clinical Chemistry, A1C tests are ordered up to 4 times per year. Getting regular lab tests can also help you determine how well you are controlling your diabetes. They all also help you and your healthcare team decide how often to use your home test as well as what your target reading should be. Know your numbers. Self monitoring your blood sugar is essential to maintaining your health. The CDC recommends that if your readings are usually low, below 60 mg, or DL or high, above 300 mg, you call your doctor right away or seek emergency medical attention. So that's all about the diabetes in this video. I hope you all liked it. For all of you, I prepared a small presentation that will be going to share in the description box below. You can check it out from there. So before signing off, I would like to request you all, please do like, share, subscribe this video with your loved ones so that they will get to know better. So this is Carrie Anderson signing off. We will definitely meet in the next video with my other content. Till then, God bless you. Bye bye and take care.